Hello, I'm Dr. Anand Shudasan, consultant cosmetic plastic surgeon, and today we have with a patient who have considerately agreed to us for demonstrating on his face how we are going to perform a deep plane facelift and a neck lift and a lot of other procedures in order to improve the aging of his face. As I said in the earlier videos, there are a lot of features and signs of facial aging that we see regularly in patients above, say, 45 or 55 or 60, how much the age, the features of say facial agings are there for every patient. So today we are going to look at what are the facial aging features and what are we going to do about it as well. So if we look in the upper face, we can see that there are a lot of fine wrinkles and there is this crow's feet which you have explained in the previous video. And the big problem in facial aging is that the brow and this area tends to sag due to aging. And what one thing that we can do with this ancillary procedures during facelift is something called as a brow lift. And in what we do in that is that we lift the brows and it gives a kind of a good look to the appearance to the eyes, and that gives a very good youthful appearance to the eyes. Along with that, what happens to the eyes is that there is a lot of skin in the upper and the lower eyelid as well. As you can see over here, there is a lot of skin excess in the upper and the lower eyelid in the skin as well. And along with that, you have a lot of fat pad behind the eyelids. So in this procedure, we'll be removing all of that, and then what else we'll be doing is that in the middle face, as you can see over here, there is a lot of fat volume loss. As you see over here, there is a lot of volume loss over here. All his fat and all his volume was a little bit up when he was younger, during his younger years. And during aging, what happens is that all this fat tends to droop and comes down to the cheek and the chin area, and the fat, the volume and the size of the fat also decreases and atrophies. And during a deep plane facelift and a neck lift, what we tend to do is we tend to reposition the fat and put it in this way. And also the another problem over here is that, you see, if you can smile please, you can see that there is a very deep nasolabial fold over here. And could you smile still? Yeah. And if we do something like this over here, you see that, this deepness of this nasolabial fold is decrease, and these laugh lines will decrease, and gives a lot of improvement as well. And in this upper lip, you see that there is a lot of wrinkles and things like that, and the upper lip tends to become a little bit thin and line-like appearance. So we'll be doing a lip lift as well during the procedure. We'll see how it looks on him and then decide on that. And the major problem which comes to facial aging is the lower face that gets affected. If you see in the oblique view, that you see this pocket of fat over here, this is called as jowl, and this jowl is something that needs to be taken care of, because all this fat comes, tends and droops over here and gives this mandibular border is not well defined. It is not at all well defined, and it gives a sort of a very aged look for this patient. So what we'll be trying to do over here is that we'll be trying to lift over and you see, just by this single action, you see that how that kind of change and everything coming for this patient. And even for if he completely stands in the profile view, we can see that there is a lot of excess skin over here. This is not just excess skin, this is loose muscle called the platysma muscle, which is excess and hanging and very lax over here, and excess of fat is also over here, and there might be even other issues over here which needs to be treated. So this excess skin can be easily removed with a neck lift also. So in a deep plane facelift and a neck lift, I can show you the results of the neck lift just by doing this very single action. As you see over here, just by this single action, this is what is gotten in a neck lift. This kind of a tightening happens, and this kind of tightening doesn't happen with the fillers, botox or threads or any sort of lifting non-surgical technique. It needs to be a surgical procedure like a deep plane facelift or a neck lift. And even in his facelift, you see that just by doing this small action, you see it improves his jawline contour, it improves his his neck contour. And when I'm just doing it on one side, you can see, you can compare it with the opposite side as well. It doesn't this side looks much younger and much tidier. And when he smiles, could you smile please? Could you smile? Yeah, this side definitely is going to look much younger, and this is the kind of lift that we'll be doing in this patient, in which how we would be performing it is we'll be putting the incision in front of the ear, and it be going through the back of the ear, and that's the only incision that will be seen appreciably outside. And this is the kind of the lift that we'll be getting for this patient, and we'll be doing some ancillary procedures like a micro fat grafting in his malar area, where we can give a little bit of youthful look for the patient as well, and a small eyelid surgeries and brow lift, and he'll be looking as he expects. And I hope I could update you after this case as well. So thanks a lot. Thank you for cooperating with me. Thank you so much. So right now we have a patient with us who has undergone a facelift and a deep plane facelift, a neck lift. So what he has undergone, as you can see over here, is that he has undergone a deep plane facelift and a brow lift and a blepharoplasty. And so you can see that he has very well achieved a much younger look. And if you look at his oblique views, you can see that the jawline and the neck is much more sharper, and the jawline, all this loose hanging skin is much more sharper, and he doesn't have all those very loose hanging skin anymore. There is a little bit of edema that you see over here, which will be getting resolved in a month also, but right now he's quite extremely happy about the way that he looks. And how do you feel about the procedure?
I was so happy.
Do you have any pain or
No,
anything
no,
after the procedure?
No pain.
All right. Thank you so much. And this is the kind of result that we want to achieve and give to the patient as well. And during this time, we tell them to massage a little bit of face and do all those sorts of activities. And he gets to do his all routine normal activities, goes back to his normal routine job right after. And yes, I'll be keeping you updated on the cases later on. Thank you so much.